Take it away.
All right, thank you, Chip. Welcome everyone to the webinar here today. I'll probably speak for about 25 minutes or so. Feel free to send any questions through the chat or raise your hand, and either way, we'll make sure to get all of your questions answered. But we are here today to talk about the SALA healthcare program brought to you through Monument Builders. And as I go through the program, I think you'll see that there's a great choice of affordable options for you to consider. That third bullet down there, less than half of U.S. small businesses offer healthcare. That's gotten quite a bit of attention over the last month or so. And that stat, so you all know, is as of 2017. And according to the Kaiser Family Foundation, I believe at the time it was 43 or 44% of small businesses at the time were offering healthcare. On average, folks are able to realize a savings of right around 60%. And I'll talk about that a bit more when I go through the pricing and whatnot of the program. And then one last bullet there, we survey participants in the program annually, and 91% said they are either very or extremely satisfied with the program. But what we are talking about today is an alternative approach to traditional health insurance. When you first sign up, you're first going to pick a plan from Apex Management. There are two options to choose from there. I'll go through those plans in detail on the second half of the presentation here. But the Apex plans are really focused on preventive care. Once you pick the Apex plan that best fits you and your family, you would pair that with a membership to SADERA. SADERA's medical cost sharing. I'll spend much of the next 15 minutes or so talking about SADERA and talking about medical cost sharing, as it may be a concept for many of you, like it was for us when we first started talking with them a few years ago. But our program, and really our healthcare in general, really falls into these three buckets, if you will. There are large costs, which we refer to as needs, and those are the significant medical events that we all have at different times in our life. It could be surgery due to an accident, maybe hospitalization due to an illness, or just some significant diagnostic imaging. But that's really where SADERA comes into play for those significant unforeseen medical events. Then there's small to medium costs. That's more the run-of-the-mill type stuff we all have at different times during our life. It could be a cold, a sinus infection, or a flu. And then there's preventive care. And preventive care will cover everything from childhood immunizations to annual physical, to colonoscopies and mammograms, and everything in between. I'll refer back to this slide a couple times as I go through the PowerPoint deck here. But like I said, let me spend a bit talking about SADERA and talking about medical cost sharing. Medical cost sharing itself started in the mid to late 80s, but it's really had a foundation within different churches and congregations with religious organizations. Over the time, the religious organizations would build an organization through which their members or parishioners could share each other's expenses. SADERA's parent company is called the CARES Group, and the CARES Group is a medical bill negotiating company, and they're the company that many of these religious organizations have used since the 90s or so to negotiate their larger bills. Well, when all of our healthcare costs started to increase at just an unsustainable rate, the CARES Group formed SADERA. SADERA is built upon the same best practices as the religious organizations, but does not have any religious affiliation or religious requirements. I think this slide explains pretty well why we're all on the call here today. And as you can see, we refer to it as the unsustainable squeeze. But as you can see, over that 10-year period represented there, on average, wages have increased by about 19%. Insurance premiums have increased about 55%, and the employee portion of those premiums have increased about 70%. So it's really what we all know, and that is simply that the cost of healthcare has increased and continues to increase at just an unsustainable rate. As I go through the slide deck here, I think you'll find that our objectives are really in line with your objectives. Enjoying the freedom to choose is something that all SADERA members enjoy, and I'll talk about that on the next slide. But it's freedom from networks. You can go to any doctor you like or a hospital you like to get the care that you need. Also, we're certainly all looking to lower our monthly expenses. When I get to the cost portion of the presentation here, I think you'll find that for everyone, it will lower your monthly expenses. And then for most of us, it will also reduce our out-of-pocket costs or our large medical costs. But medical cost sharing is unique. Every member is a cash pay patient or a self-pay patient like you see up there. So it's not like insurance where there's a transfer of risk. Every member is a cash pay patient. What that allows, however, is freedom from networks. Like I mentioned, SADERA members can go to any hospital they like or doctor they like to get the care that they need. Also, one last thing to note on this slide is sharing is on a per need basis. So rather than having a large overarching calendar year deductible to manage, sharing is on a per need basis. And I'll talk about that a bit more as I go through the actual cost sharing mechanics in a couple of slides. But first, one last illustration here. This just shows the adoption rate of medical cost sharing. You see that uptick starting around 2011, 2012, when all of our healthcare costs started to increase at just an unsustainable rate. By the end of 2017, there are more than 1 million members sharing more than $1 billion annually. That membership number now is close to 1.5 million as it continues to grow. But let's talk about the mechanics on how the cost sharing works. And again, we refer to these significant medical events as a need. And I apologize for the dog. But what is a need? A need is one or more medical expense caused by a single accident or illness. So when you enroll, you select what's called your initial insurable amount, or IUA, and that's the amount you're going to be financially responsible for if and when you have to use your membership. As you can see, there are 5 levels there to choose from: 500, 1,000, 1,500, 2,500, or 5,000. So if we look at the illustration here on the left, this is someone who broke their leg. So they would have costs for, say, the ride in the ambulance, to stay at the hospital, surgery, and diagnostic imaging, and prescriptions, and physical therapy, and all of these costs, right, are wrapped up into that one need. Whether they occur over a period of weeks or over a period of years, the member's responsibility is that IUA. So to make the math easy, let's say the broken leg scenario here was $10,000, and you had selected the $1,000 IUA. You'd be responsible for paying that first $1,000 to balance the $9,000 we shared through SADERA and paid accordingly. And I'll talk about that in a couple of slides. The last thing to point out on this slide, however, is that if you enroll as an individual, you'd be responsible for the first 3 needs in the calendar year. If you enrolled as a family, you'd be responsible for the first 5. As a practical matter, we all have far fewer than that in a calendar year. But if you did have a 4th more as an individual or a 6th more as a family, you'd be at a $0 IUA. So if you look at this slide and you're trying to figure out what your maximum exposure might be, or what your maximum out of pocket might be, if you enroll as an individual, it'd be 3 times your IUA. If you enrolled as a family, it'd be 5 times your IUA. So for myself, for example, when I enrolled in 2018, I selected the $1,500 IUA. So my maximum out of pocket in a year is $4,500. Now, again, as a practical matter, we all have far fewer than 3 needs as an individual or 5 as a family. But again, it's good to know that if you did have more than that, at least there's a cap on what your exposure is financially. This is a real quick real-life example. This actually comes to us from the CEO of SADERA. Prior to joining SADERA, he and his family had a young child with a persistent ear infection. They were, of course, on traditional insurance with a $5,000 deductible. Their son, after a series of antibiotics and boosters, went to an ENT who inserted tubes into the child's ears. On the left, you can see their out-of-pocket costs with copays, and then the cost of the surgery was around $2,500. And on the right, of course, if they'd selected the $500 IUA, their out-of-pocket cost would be just the $500. Now, the cost sharing works in really 2 ways. One is a situation like this, where it's a scheduled event. If that was the case, the member would call SADERA in advance and tell them what was going on, and say, a week from tomorrow, their son was going in for this procedure, and they had a need to be shared with the community. Given the relatively smaller amount financially of this need, chances are that's all would happen. But let's say that this need was more. Let's say it was $250,000. If that was the case, most likely SADERA, through their parent company, the CARES Group, would reach out to the hospital, reach out to the doctor, reach out to the facility, and inquire even about prepaying. When we first started doing our due diligence on the program back in 2017, we reached out and spoke to a couple of hospitals, and we asked them, if someone prepays for a surgery, which is what would happen here, and essentially pays in cash, what would the hospital do? And all 3 hospitals gave us the same answer, which was they would discount the cost of that surgery 50%, which was obviously pretty eye-opening for all of us. But nonetheless, SADERA, through their parent company, they're able to save on average between 47 and 53% off of the list price, if you will. But that's what might happen if it's a scheduled event. Let's say it was an emergency. We can use a broken leg scenario. If that's the case, you obviously go right to the doctor or right to the hospital and get the care that you need. Afterwards, when you're feeling better, you reach out to SADERA, you let them know what happened, of course, and that you have a need for sharing. At that point, the member would be responsible for uploading those bills to SADERA. And then SADERA, I apologize, I have some computer problems here. SADERA would then facilitate that sharing to the community. The member would receive a check in about 3 weeks on average, and they would pay the balance of their bills. SADERA did a study, and the average family will spend about 6 hours per year, for what it's worth, administering the program, if you will, because the members are responsible for gathering the invoices and the bills from the hospital and from the doctors, and then submitting them to SADERA. Again, for the cost savings that people are able to realize, the 6 hours has not really been an issue, but just so everyone knows, there is some personal responsibility here and some administrative work that folks will need to do. There are also some nuances to the program, of course, as you might imagine. These next 3 slides really help illustrate that this is an option that would work well for you and your family. The first slide here is relatively straightforward. That is, when members sign up, they commit to a few things. One is to strive to live a healthy and balanced lifestyle. Obviously, making smart choices like diet and exercise can improve one's quality of life, but also keeps us all healthy and keeps our costs down. And striving to live a healthy and balanced lifestyle is obviously not legally binding. They're not going to make sure you're eating fish 3 times a week and exercising, but it is something that members have to commit to do. Members also have to commit not to use illegal narcotics and not to operate a vehicle while intoxicated. So what does that mean? It means if you're operating a vehicle while intoxicated and you had an accident and you were hurt and you had medical bills associated with that accident, those bills could not be shared with the community. The principle there is that the community should not have to pay for someone's illegal or reckless behavior. Also, tobacco users are certainly welcome to join. Everyone is, but there is a $75 surcharge per month per household. So in other words, if you're a husband and wife who both smoke, it's $175 surcharge per month, not 2. Lastly, the fine print on the bottom there, tobacco users over the age of 50 have a $25,000 per need sharing limit for the top 4 disease states associated with tobacco usage, which is heart disease, stroke, COPD, and cancer. Medications. There are basically 2 types of medications we all take, if you will. Those that are curative and those that are maintenance. Curative medicines could be antibiotics or pain meds or chemotherapy drugs, but these are drugs we take for a period of time until we are cured. The costs of the curative medicines are shared through the community and part of that IUA math we just went through. The other type of medicines many of us take, myself included, are maintenance medicines. It could be for high blood pressure, high cholesterol, an overactive thyroid is a very common one. I take them for rheumatoid arthritis, but these are medicines we take daily, weekly, or however they are prescribed, and we'll do so for the foreseeable future. Now, if you enroll as a member of SADERA and you have a new diagnosis, I'll use myself as an example. I enrolled in 2018. Let's say in 2020, I was diagnosed with rheumatoid arthritis. If that was the case, for the first 120 days, the cost of my prescriptions would be shared through the community and paid like we just discussed. I've had rheumatoid arthritis for many years, however, so for me, it was a pre-existing condition, and I've been responsible for the cost of my medicine since I enrolled. Now, there are great third parties out there, GoodRx, Liberty Benefits. There's the one with Martin Sheen that I see on TV all the time out here in DC, and I'm sure you see plenty of prescription discount commercials as well. And I'll tell you, they have great discounts on drugs that are commonly prescribed. High blood pressure, cholesterol, drugs that are in generic form at this point. Oftentimes you can find them through these third parties for less than $10 per month. I get my prescriptions actually filled through the Apex prescription program. So when I get to the Apex component of this program, I'm going to revisit prescriptions and also talk about this slide a bit more. Prescriptions are the second most common question we get from folks who are looking to enroll. So I will spend my time on that. The first most common question we get from folks looking to enroll is actually on this slide here, and that is restrictions on pre-existing conditions. Now, SADERA defines a pre-existing condition as anything you've had a symptom of or received treatment for in the prior 36 months to enrolling. So when I enrolled, of course, I disclosed I had rheumatoid arthritis. Now, on the Apex component of the program, when I go to my rheumatologist, which I have to do a few times a year, that's covered. I pay a $50 copay. My prescriptions, like I said, are covered, and I'll talk about those more when I get to the Apex component. And then my blood work that I have to get done a few times a year, that's also covered under Apex. What SADERA is saying is that if your pre-existing condition leads to a need, if it leads to a medical event, that's when these restrictions would come into play. So again, use myself as an example. Let's say with my rheumatoid arthritis, I needed surgery. If that happened in the first year, I would have been 100% responsible for the cost of that surgery. If it happened in the second year, up to $15,000 would be shared to the community. The balance would be my responsibility. If it happened in the third year, up to $30,000 would be shared. Again, the balance would be my responsibility. After that, it's fully shareable. So what we generally tell folks is that the program itself is a good option for probably 75 or 80% of us to consider, but it's not going to be the option for everyone. Depending on your needs and depending on any pre-existing conditions you or your family might have, the program might not actually work very well for you. Let me give you an obvious example. Let's say when I went to enroll, I was currently going through treatment for cancer. Or let's say we went to enroll as a family and my wife was pregnant. If either one of those were the case, it would obviously be pretty significant pre-existing conditions that we would be responsible for financially. So it would create a huge financial burden for us. And that's exactly what we're all trying to avoid. So like I mentioned, by far the most common question we get from folks is on pre-existing conditions. At the end of the slide deck and on the MBNA website that I'll pull up here later, you'll have all of our contact information. Please feel free to reach out to us anytime. I know it's not easy or comfortable talking about pre-existing conditions in a group setting. So just know we're more than happy to talk with you all about them one-on-one, or with you and your family or whomever is needed. Now, included with your membership is a subscription to Teladoc. Teladoc is the largest provider of telemedicine in the US. Telemedicine's certainly been in the news quite a bit this year with COVID and whatnot. But even last year, telemedicine and Teladoc was used significantly by our members. If you've not used telemedicine in the past at all, it's exactly what it sounds like. You connect with the doctor virtually, over the phone or through your computer. It can be a video call, it can be just a normal phone call, but doctors are available 24/7, 365 days a year. So if you need to talk to a doctor at 2 o'clock in the morning, you can talk to a doctor at 2 o'clock in the morning. Telemedicine is now offered by 100% of all the Fortune 500 companies as well. And the reason is it's a money saver and a time saver. It's a great time saver because instead of having to go to urgent care or going to see your doctor, if you just need a simple prescription, for example, you can just connect with the doctor virtually. Those doctors can prescribe medicine for you. So, and you can just pick it up at your local pharmacy. Also, it's a great money saver, if you will, because your monthly cost for Teladoc has been built into your fee. So there's no additional out-of-pocket cost for you. There's not a copay or anything else you need to worry about. So you can use Teladoc as often as you like. And Teladoc it's a great service. Even their app on the App Store has nearly 5 stars. It's truly just a great service that's out there. And more people are using it. And it's great for the small stuff. You have an earache or a cold or the flu. Let's say you just need a Z-Pack or something like that. The doctors at Teladoc can prescribe it, send it to your local pharmacy. You can pick it up and be along with your day. Also included is Second MD. Second MD is a great way to get a second opinion on anything you're going to, medically speaking, of course, and some of the nation's top doctors that practice at places like the Mayo Clinic and Johns Hopkins and elsewhere. Second MD is there really for 2 reasons. One, there was a study that showed that the average physician was 13 years behind on his or her continuing education. So Second MD makes sure we all have access to the most up-to-date information. Maybe there's a new drug that's out there, or maybe there's a less invasive procedure. The other reason it's out there is that if you're having an elective surgery, Sedera requires you to get a second opinion, and you'll do that through Second MD. And again, it's not a heavy lift. It's usually handled in a phone call or an email or 2. And for what it's worth, when we do our annual survey, the folks at Second MD get among the highest marks from folks as well. They're really outstanding people there too. But that's for the Sedera component of the program. Again, Sedera is really focused on those large costs or needs, as we call them: surgery due to an accident, hospitalization, maybe just some significant diagnostic imaging. But they also have the other ancillary services to help with the small to medium costs like Teladoc and even Second MD. But now I'm going to talk about Apex. These are 2 separate companies. There's no relationship between them. But Apex is really focused on preventive care, but does also have some ongoing care that can help with the small to medium costs. But the first option is the basic option. And to be honest, it's just that, it's basic. Excuse me. It covers all of your preventive care services, 100%. 21 services for adults, 28 for women, 31 for children. If you all recall back to when the Affordable Care Act was passed, and the Affordable Care Act mandated that we all have certain preventive care services covered, these are those services. So even though the penalties from the IRS have gone away, some states have implemented them and other states are looking at implementing them. But the point being here that the basic plan meets all the federal and state requirements for preventive care, so no one should see any fines. The basic option, however, does not cover anything else. So if you have the flu, for example, and you want to go see your doctor rather than using Teladoc, you would pay for that office visit out of pocket. Also, it does not have prescription drug coverage. So you would have to look to some third parties like GoToRx or CleverX or other ones like that, or Liberty Benefits and others. And like I said, we have plenty of people on the basic plan and they're able to get their prescriptions fulfilled for less than $10 per month. The Advantage plan, which I'll talk about next, does have a prescription drug program. So I will spend some more time talking about that. But the last thing on the basic plan is that it does meet the federal government requirements to set up an HSA. A health savings account, as you may or may not know, is a great way to put away tax-free dollars to be used down the road towards any future qualified medical expense, such as dental, vision, prescription, doctor visits, and also to pay your Sedera IUA. For 2020, individuals were able to put away $3,550 per year, family $7,100, and those over 55 an additional $1,000. To be honest with everyone, if I did not have rheumatoid arthritis and did not need the ongoing care that I'm going to talk about here in a minute, I'd be on the basic plan. I'd save some money, and I would also take advantage of the HSA. I think it's a great vehicle. But I do have additional needs that I have. So I am on the Advantage plan. The Advantage plan, again, it covers all your preventive care services, 100%. It's everything from childhood immunizations to your annual physical, to colonoscopies and mammograms and everything in between. It then has the co-payment structure. So if you go to your primary care doctor outside of preventive care, it's a $20 copay. If you go to a specialist, like I go to my rheumatologist, it's a $50 copay. Any lab or imaging work or the blood work I get done is a $50 copay. And this has the prescription drug program that I mentioned. You have tier 1 and 2 generics, tier 3 preferred brand name, and tiers 4, 5, and 6. If you recall back to that slide on medications when I was discussing Sedera, we had curative medicines on the left and maintenance medicines on your right. Generally speaking, your maintenance medicines are in tiers 1, 2, and 3, and tiers 4, 5, and 6 are medicines that are more curative in nature, and those would be shared through Sedera. There is an exception to that, of course. The one exception we've had to that actually in the last 2.5 years or so was a woman whose husband suffered from seizures. Just the nature of the medicine he was on, it was not in tiers 1, 2, and 3, so they did actually use a third party to source that medicine for him. But for what it's worth, I take 2 medicines for my rheumatoid arthritis. One's at tier 1, the other's at tier 3. And the majority of folks who are enrolled in the program do get their prescriptions filled through the Apex component here. Also, when I mentioned that prescriptions were the second most common question we get from folks, feel free to reach out to us. We can look up your prescriptions that you take. We can make sure, 1, that they're covered, but 2, we can also tell you what the cost would be at your local pharmacies. So feel free to reach out to us. Our contact information is on the MBNA website and also at the end of the slide deck here. Now, when I talk about Sedera medical cost sharing, I made sure to point out that people, Sedera members, are able to enjoy freedom from networks. You can go to any hospital you like or doctor you like to get the care that you need. On the Apex side of the program, they use the multi-plan network. The multi-plan network is actually the largest network in the US. It has more than 900,000 doctors and tens of thousands of facilities. And it's used by thousands of healthcare programs like ours, and it's also used by United Healthcare. So it's actually the largest network in the country. So with Apex, you do get a card, just like you probably have now. And as long as you're getting, as long as you're going to a doctor that's in network for any preventive care or any ongoing care, you give them the card, and either it's a $0 copay because it's preventive care, or it's a $20 or $50 copay like we just discussed. On the MBNA website, there are directions on how to query the network. So I'll talk about that a bit more when I pull up their website. But let's talk pricing, let's talk cost and what all this is going to cost. What's important to note is that we all pay the same, regardless of our sex, and regardless of where we live, we're all paying the same amount. This first slide, as you can see, is for the Apex plans. On the left is member only, meaning you enroll as an individual, or you and your spouse, or you and just the kids, or you and the entire family, meaning spouse and children. The second column here is obviously for the basic plan. Again, the basic plan only covers your preventive care, but does allow you to set up an HSA, and starts at $71 and goes to $102. And the third column is the Advantage plan that has the co-payment structure, the prescription drug plan, and of course covers your preventive care. And you see it starts at $145 and goes up from there. Once folks pick the Apex plan that best fits them and their family, they would pair that with their Sedera membership. On the left, MO is member only, MS is member and spouse, MC is member and just the kids, and MF is member and the entire family. Sedera is then banded across the top by age for those in their 20s, 30s, 40s, 50s, and 60s. The 2 most common IUAs are the $1,000 and $1,500 IUA, but bear with me for just 1 second. Let me pull up the MBNA website, and I'm going to refer back to this again in a little bit. But here you have the pricing for all the IUAs. Again, there are 5 IUAs, 500, 1,000, 1,500, 2,500, or 5,000. And what I wanted to point out, this is the IUA I'm on, but the higher the IUA, meaning the more you're willing to pay out of pocket if when you have to use your Sedera membership, the lower your monthly contribution would be. So if I selected the $5,000 IUA, I'd be paying $134 per month. Conversely, of course, if I'd selected the $500 IUA, I'd pay $212 per month. So again, the higher the IUA, the lower your monthly contribution would be. Here's just a quick example. This would be the same for everyone who made the choices I did, which is the Advantage plan for the ongoing care that I discussed that I need. And then the Sedera $1,500 IUA. So my monthly cost is $320 per month. And so for me being in Maryland, right outside DC, my savings is right around 55% compared to what I was paying on the Blue Cross Blue Shield plan back in 2018. But also, instead of having a $7,000 deductible to deal with, I have a $1,500 IUA on a per need basis. So again, if I broke my leg tomorrow and I need surgery, my out of pocket on that would be $1,500. I don't have that large overarching insurance deductible. Also, when I mentioned that the average savings people have to realize compared to traditional insurance on the state exchanges, it varies quite a bit by where you live. It may be a little eye-opening, folks, to realize that, but where we are here, right outside DC, my savings is right around 55%. But for folks we have in more rural areas of Colorado or Alaska and elsewhere, they're saving 75, 80%. So not only will it vary by the selections you make within our program, but it also varies by what you're paying now, which is really driven quite a bit by where you live. On the MBNA website, which I'm going to pull back up now, this first tab here, once you get to their website and select the healthcare program, it will take you to these pages. This describes the program. What's important here, here's our contact information. Feel free to reach out to us anytime if you want to talk about pre-existing conditions or prescriptions. If you'd like for us to talk with you and your family or you and your staff, the best way is actually to send us an email or call us. Either one will put you right into your help desk and we'll schedule the call from there. Once you click on program components, it takes you to the details. Up here in this top right is the video of the exact presentation we're going through right now. That's the same slide deck. If you click on Apex, there's a wealth of information. The rate sheets that I just pulled up for the advanced plan are here, the basic plan are there. How to search the PCHS network, the multi-plan network, that is there. One point of caution I would give you in searching the network, sometimes doctors can register by their name and sometimes they register by their practice name. So oftentimes it's best to run a complete directory. I apologize, I've got some feedback on the line. Next is Sedera. There's a great short video here on Sedera I would encourage you to watch. Also, their membership guidelines, which are the key driver in determining how the cost sharing is handled. Then there's Teladoc, of course. By the way, if you've not used telemedicine, there's a great FAQ here on telemedicine that I would encourage you to read. Even if you're not going to sign up for a program, it's a great explanation on how telemedicine works in general. And lastly, SecondMD, and I'm sorry, lastly is the dental option. We don't have a slide on the dental option. To be honest, it sets up just like every other dental program that's out there. You can download the brochure there. The pricing is here. It's not going to save you significant money. It might save you $1 or $2, and the provider search is there. The point here, though, is that it's on the Aetna Dental Network, so it's a great network. It's a nationwide network. The program itself, it's like every other program that I mentioned. It generally covers your cleanings and all your preventive care 100%. Then has an annual cap for additional services like root canals or caps and things of that nature. But certainly on the MBNA website, there's a wealth of information to review at your leisure.
Yeah, Kevin, real quick, this is Chip, a real quick question for you. On the rate sheet that you were showing a couple of slides ago, I noticed that the age grouping capped out at 60 to 64. And for employees of MBNA members who are 65 and plus, like I am, what's the situation with them? Does that 60 to 64 continue at that rate, or is there
no,
a different situation?
We're not able to offer the program to folks over 65 at this time.
Okay, thank you.
Yeah, sorry about that. Yep. So the program itself is available right now in 46 states. It's temporarily unavailable in Vermont, Washington, New York, and Illinois. Washington, New York, and Illinois should free up next, sometime next year. It does not need employer sponsors, so individual employees can join, full-time, part-time, or seasonal, hourly, or salaried. The monthly cost can be paid by the employee or the employer. So if you're an employer and you'd like to offer this to your staff as a benefit and offset it with a payroll deduction or something of that nature, just let us know. Reach out to us. We'll send you a one-page form to set up what's called a list bill. If you are an employer and you don't want to offer this to your staff for whatever reason that might be, but you want to make it available to them, they can certainly enroll and participate in the program directly and be responsible for those bills. And they actually do that right from the MBNA website. When you're on this program component tab, you hit enroll now. And there are actually a couple of short videos on the enroll now, but it takes about 10 or 15 minutes and they can enroll. The only caveat, of course, to enrolling is you must be an MBNA member and a member in good standing, of course. But lastly, here's our contact information. Like I said, it's also on the MBNA website. Feel free to reach out to us anytime. If you'd like to talk with us about pre-existing conditions or prescriptions, if you'd like for us to present this webinar to you and your staff, or just have a conversation with you and your family, just let us know. We're more than happy to schedule that and speak with you all whenever it fits your schedule. But with that, were there any other questions from anyone?
Right. Those of you MBNA members, those with MBNA member companies on the call, any questions you have for Kevin? Questions or comments?
And again, if not, like I said, I know it's not easy talking about pre-existing conditions in a group setting or anything like that. Feel free to shoot us an email. We can talk with you one-on-one, get your questions answered. The last thing we want, and I know Chip and staff would agree on this, but the last thing we want is for anyone to sign up and not understand exactly what this is or understand the restrictions on pre-existing conditions. So please ask as many questions as you can, either now or in private, and get all those answered for yourself and your family. But with that, Chip, if there aren't any other questions, I'll throw this back to you and we can give everyone back their day, perhaps.
Great. Thank you all. Kevin, I very much appreciate it. Very informative, and particularly for folks like Charlene and myself who are relatively new to the MBNA universe, having been supporting the organization for the last 5-6 months at the start of May. So it's very helpful for us, and we certainly will, you have our pledge that will help spread the word out to the MBNA membership as well. And direct them to you if they have questions or just want to have a conversation about it. So I appreciate your doing this. We've recorded again this, and as you mentioned, Kevin, the same presentation is already up on the website. So we'll direct members to that as well. So if there aren't any questions, I will thank you again and give everybody back a portion of their day.
Thanks, Chip. Thank you, everyone. Have a great Thanksgiving.